Hello, my name is Bianca Monson, and I am the Data Project Manager for the Child and Family Data Archive. Thank you for joining us for our webinar on how to access and use data from the Child Care and Development CCDF Policies Database. This webinar is hosted by the Child and Family Data Archive, Urban, and the Office of Planning, Research, and Evaluation, OPRE, within the Administration for Children and Families, ACF, and the U.S. Department of Health and Human Services. We're joined by Kelly Dwyer, a research analyst at Urban Institute. Kelly will be leading the presentation today, but before we turn the presentation over, I'll briefly introduce you to the Child and Family Data Archive and let you know about the structure of this webinar. Next slide, please. The Child and Family Data Archive is supported by a contract from OPRE and housed at ICPSR within the University of Michigan. It is the place to discover, access, and analyze data on young children, their families and communities, and the programs that serve them. Users are able to access over 300 datasets with the ability to analyze selected datasets online. Users can also search and compare variables to peruse data-related publications. And of course, user support is available to assist users in finding and obtaining data. Next slide, please. For today's webinar, Kelly will give you an overview of the Child Care and Development Fund CCDF Policies Database, including an overview of the study's data files and documentation, information on the data file structure, and considerations to be mindful of when using the data. I will then let you know how to find the Child Care and Development Fund CCDF Policies Database on the Child and Family Data Archive website and show you how to access these data. This webinar will close with a Q&A session. And with that, I will now turn the presentation over to Kelly.
Thanks so much, Bianca. As she mentioned, my name is Kelly Dwyer, and I'm a research analyst in the Income and Benefits Policy Center at Urban. And today I'll be giving you an overview of the Child Care and Development Fund Policies Database, and one of the specific data products that is housed at the Child and Family Data Archives are data files. So to briefly tell you a little bit more about the database, it is funded by OPRE, and thanks to Bianca for defining that for everyone, and is maintained by the Urban Institute. It serves as a single source of detailed policy information on the Child Care and Development Fund program for all 50 states, DC, and 5 outlying areas and territories. We collect this information from state and territory caseworker manuals and updates that are provided to those manuals to administer the program, and we code those into our database. We capture really detailed policies over hundreds of policy variables, and in addition to capturing policy changes over time and the exact dates when these policy changes are implemented. It doesn't track policy changes or proposals, or it doesn't track policy proposals or policies that have not yet gone into effect. And we currently have data available from fiscal year 2009 through fiscal year 2019, and we release new data annually. The database contains information across a few different broad policy categories, and I can tell you a little bit more about them here. We have eligibility requirements for children and families, including at what age children are eligible, as well as activity requirements for parents and income eligibility thresholds. We also capture information on family copayments, including the full detail of state copayment charts and how copayments are administered and whether any families are categorically exempt from paying copayments. We also pick up information on application criteria and verification and redetermination requirements, as well as any requirements for families to report changes during their eligibility period. Finally, we include various provider policies, including detailed reimbursement rates, policies for unlicensed home-based providers, including health and safety requirements, and then we include basic eligibility requirements and other policies for all providers in the subsidy system. And to give you a better picture of the process that we use to collect this information and publish the data from the database, I can walk you through our annual research cycle. We begin by collecting materials, as I mentioned, from state and territory caseworker manuals and other updates used by states and territories to administer their CCDF program. We collect these materials on an ongoing basis so that we can capture the full policy details as well as the exact dates for when these policies change. After we collect these materials and code them into our database, which generally takes about 6 months, we prepare a set of tables that some of you may be familiar with. We call them our annual book of tables that focus on selected policies from the database that we think are really key to understanding how the state or territory's CCDF program functions. After we prepare these tables in the early fall, and they focus on one specific date every year, which we have chosen to be October 1st, we'll provide a copy of the draft tables to states and territories and work with the state and territory administrators and staff to verify the data and update our underlying database with any new information that they're able to provide us. We then publish our annual book of tables, which is a part of our annual report, and are able to update the data files, which I'll be discussing in more detail throughout this presentation, as well as our search tool that's available on our project website. And so the verification process with states and territories, as well as releasing the data, generally occurs in the spring of each year. And then when we finalize the data changes and draft the report, we're able to publicly release the data in the fall following the focus date of the report, meaning that data for 2020 will likely be available later this year or early next year. As I mentioned, we have a few key data products that allow you to access the information from the database. The first, which many of you are probably familiar with, is our annual report and the companion briefs that go along with it. They focus on selected key policies from the database at a single point in time, which, as I mentioned, we have selected to be October 1st of each year. If you're more interested in the full database detail, including all of the policy variables and finding out exactly when policies changed, you can access that through two different sources. The first is our website, a screen grab of which is shown on the right hand of this slide. And you can access the website at ccdf.urban.org. And there is a search tool there that allows you to produce custom tables based on the policy categories and policy variables that you're interested in. The second are the full data files, which I'll spend the majority of this presentation talking about. The data files provide the full database detail for all of the policies in the database over time. And they're available in a couple of different formats from the Child and Family Data Archive, as well as being available in an Excel file from the CCDF Policies Database website. Each year, the data files are updated to include the newest information, so we recommend using the most recent data files that have been published for your work, since they may contain corrections to historical data or additional historical data when we have been able to obtain additional materials during our annual verification process with states, or we're able to fill in previously missing information. So there are a few things for you to consider when you're using the detailed data files. You'll first want to decide which variables you're interested in and how they are coded. It's important to understand how records are coded in the database and why there might be multiple records for each state, which I'll spend the rest of the presentation talking about. The first step for using the data files is to review the user guide. The user guide is also referred to as the code book on our project website, and it provides detailed information about the variables in the database, including the variable names, definitions, coding options, and coding notes and instructions. The user guide opens with an introductory section that provides information about the full data files and the database structure, followed by separate sections for each policy category and the variables in each category. Each individual data set has an associated code book that contains all of the relevant information for that section of the user guide. To identify variables of interest, you can review the complete sections of the user guide in a couple of different ways. First, you could review the complete sections for the relevant policy category that you're interested in, or you could search the document for key terms. For example, if you're interested in how the family unit and income are defined for eligibility, you could review the sections for the policy categories for definition of family and definition of income. Alternatively, if you're interested more broadly in policies for families with teen parents, you could search the full document for the term teen parent and find policies such as how a teen parent is treated when defining the family unit and whether teen parents are given priority for subsidies when funds are limited. As previously mentioned, the user guide and code book provide detailed information about each variable in the database, including the name, definition, and coding options. And I just wanted to walk through a specific page of the user guide to give you a better sense of how you would use it in your own research. So we can see here that the user guide contains a table, and the left-hand column of the table includes the variable name. If we come down to the last row, we see that this is the variable capturing information about the amount of child support paid for children living outside of the household that may be deducted from the income when determining eligibility and copays. In the right-hand column of the table, we see that it contains the coding options. So we can determine from the caseworker manual whether all, none, or a portion of the child support paid to children living outside the household could be deducted. It also contains coding notes that let you know how this variable was coded by the coder who put it into the database, and also any information that you might want to keep in mind when using it in your own research. The user guide and codebook also include additional notes, as I mentioned here, and they're really important for you to consider, and also help you identify any closely related variables elsewhere in the data files that you might want to use when conducting your own research or finding out policies of interest. So now that I've talked a little bit about how you can identify policy variables that you might be interested in looking into in the data files, I want to dive a little bit deeper on the actual structure of the data files and some of the nuances that come along with that. While the data files are broken into separate data tables or data sets for each category, they all follow the same general format. And to show you this general format of the data files, we're going to be using selections from the Excel data tables because that's easier for us to view than other formats. So in each table, the rows represent separate records of information and the columns represent policy variables. A record in the database contains the policies that apply to a particular state, time period, and group. Each column represents a variable in the database, and there are 3 broad sets of variables in each table or data set. The header variables that provide identifying information for the record, and I'll get into that a little bit later. The policy variables and their associated notes variables that capture the detailed state policies, and these are the ones I mentioned a couple slides back when I discussed the user guide, and the category notes variables that pick up any additional information that the coder thought might be relevant to capture for that category, whether it was something that didn't necessarily fit neatly into one of the policy variables or predefined coding options, or perhaps it's a note that might apply to all of the policy variables in that category. And it's important for a user to understand when using this policy category. For the policy variables, you'll see that there's a corresponding note field, and it is the policy variable name followed by underscore note. This note picks up any additional details that are relevant to that specific policy. And in some cases, it's just providing a little bit extra information, but in some cases, it's actually providing the specific policy, because for some policy variables, the coding options include things such as other or varies. And so we need to pick up how that policy varies and why it wasn't able to fit into one of those predefined coding options. However, there are some variables in the data files that do not contain individual notes fields, such as the dollar amounts for copayments, because there are such a large volume, and what this one note can typically apply to all of the copayment amounts. So back to the header record variables, they are really important for you to help you figure out which record you want to use when you're using the data file. And as I mentioned, they are the same for each category. These variables provide the information about the location of the record, including the state and county, and subsequently the program name, the group, which is the family, provider type, or provider subtype, and the dates to which the policies apply, shown here in the beginning and ending date. The last 3 columns that you see here in this table contain the majority record variables, which I'll go into more detail on in a minute. For the family group variable that you see here, this picks up cases where there might be variation for different subgroups of the population, such as different requirements for families who are receiving TANF, or different copayment policies for families with children who have special needs. Additionally, the date header variables indicate the date the policies first became effective and the last date that they were in effect. You'll sometimes see, or you'll frequently see actually, the date code 99991231 as in the end date for the record in the last row of this table. And this indicates that the policy is ongoing or open-ended. So when we last coded the information into the database and produced these data files, the policy was still ongoing. So we needed a way to say that this is still in effect. Now that we understand the general structure of the data files, including the header records, policy variables, and notes, we can talk about how to determine which record you want to use if you see that there are multiple records for one state in the database. In the data files, you will see multiple records for states in each category. For a single state, there could be multiple records for a couple of different reasons. There could be variations in policies for different sub-state areas, such as different counties or cities, variations in policies for different types of providers or groups of families, like I mentioned earlier, or there could be variations in different policies for CCDF funded programs in a single state. The most common, however, is that there's variation in a policy over time, meaning that we have to code a new record every time a policy changes. Because the database tracks policy changes over time, anytime a policy changes in a state, we code a new record for the state to capture that update to the policy. Within a policy category, if any of the policies change in that category, we have to code an entirely new record. And the new record will reflect the policy change to that specific policy variable, and it will carry any previous coding forward, meaning that the variable coding might match across multiple records in a state. To go back to the example earlier, when we were looking at the definition of a teen parent, let's say that you're interested in finding out what age a parent would be considered a teen in a single state. And there might be 5 records for the policy category definition of family for that state. And then when you're looking specifically at that variable defining how old a teen parent is, you would see that it has the same value listed for every single record. This means that another policy variable in that policy category changed, and we had to code a new record because of that. To make this a little bit more concrete, we're going to take a look at an example from the copayment adjustments policy category in Texas. You can see that there are several different records or rows of information coded here. And you can see that the state, which is shown here as 48, the provider type and the provider subtype are the same across the records shown. But the other information in the header record variables, such as county, specific program name, and begin and end date are different. And I just want to flag here that if you're looking at the data files and you're confused as to what the state number, county number, program number means, you can reference the user guide, and that will let you know what those numbers correspond to. One reason that Texas has multiple records in the copayment adjustment categories is that there is sub-state variation. In this case, there are some state level policies coded, represented by the County Code 44. And then there are sub-state areas coded, represented by County Code 192, which corresponds to the Gulf Coast region in the state. You'll also see that the program name changes between the first 5 records and the last 4. This is because in Texas, the Gulf Coast region actually has a different name for the program that administers their CCDF program on the local level than the statewide program. Another reason that there are multiple records for this state and policy category is that there were policy updates captured over time. For example, we see that in the second record or second set of policies coded here in this data table, the policy changed on October 1st, 2011, meaning that at least one policy or variable in this category changed on that date. So we had to create an entire new record to show that. So when you're going through the data files, you'll find that many states have multiple records in each category due to policy updates or subgroup or substate variation. But when you're using the data for your research, you might decide that you need to select a single record or a single set of policies to represent the state's policies at a given time. For example, if you're trying to combine information from the data files with annual state level administrative data, you might need to select a single set of state policies for that year to represent all of the policies for that year in that state. And this is where the majority record header variables come into play. The majority header date variables in the database, shown here as begin majority and end majority, help us identify the records that apply to the most populous area of the state when there is sub-state variation and no state level policy. These variables can be coded in 2 different ways. The first is with dates that match the general date variables, begin date and end date, and this means that the record shows the policies for the most populous area of the state. The second is to code the begin majority and end majority dates with all 8s. This means that the record is not showing the policies that apply to the most populous area of the state. For example, in the data table shown here, for the reimbursement rates category, Massachusetts, which is FIPS code 25, like many states, has different rates for different regions in the state. In this case, the rates that apply to the most populous area, which they've told us is Region 6 or County Code 166, shown in the bottom two rows of this data table, will have the majority dates coded to match the regular date fields, begin date and end date. We see here that they do match, and begin majority and begin date are both coded as July 1st, 2019. For the areas of the state that are not the most populous, we can see that the majority dates fields are coded with all 8s. Additionally, the majority record header variable identifies the single record or majority record for each state and time period that can be used to represent the state's general policies. When this variable is coded -1, it identifies the record for the state and time period that fulfills a couple of different requirements. First, this means that the record applies to the most populous area of the state, whether that's statewide or in the case of the reimbursement rates for Massachusetts, it applies to the most populous area. Second, it means that the policies in this record apply to a certain subset of families, which are families with a working parent or guardian who are not receiving TANF, who have, or transitional childcare, who only have one child in care, and who do not have a child with special needs. It also applies to a certain subset of providers. And here we're looking at policies, records that show policies for licensed center-based care provided at a base level that does not include any higher quality or tiered reimbursement rates for providers. This information is outlined in the introductory section of the user guide, and you can use the majority record variable to help you identify a single record for a state and time period for your research, or you may choose to select records based on your own selection criteria. For example, in the reimbursement rates shown here, you may be interested in a different region of Massachusetts. So you could identify which of those regions correspond to the regions shown in the database for reimbursement rates and use the rates shown for that region for your research. I want to leave you with a couple of important things to keep in mind when using the data for your own research. First, as I've mentioned, the data cover policy changes over time that include changes that occur within a single year. For example, if a state updates a policy in January, March, and June, we would capture how the policy changes in each of those months. As I previously noted, if you're matching your data with another data source, such as administrative data or licensing data, you may need to select a single date for the policy data and filter to that in the data files. Additionally, you'll want to think about the unit of analysis for your own research. For example, if you're using the data for state level analysis paid for a state level analysis, you'll want to pair other state level data. You'll need to determine how to select a single set of policies for the state, especially if there's a great deal of sub-state variation. However, if your analysis is for a county in your state, you can incorporate any county variation into this policy. You'll also need to decide how to handle policies for different subgroups of families and whether to include those families and policies in your analysis. For example, if you're looking specifically at policies for families who are receiving TANF, you'll want to be sure to filter down to any relevant policy variables and also search through the user guide to find out what the relevant codes are for families who are receiving TANF or families in transitional childcare. It's also important to keep in mind how we have defined terms for the database as outlined in the user guide. We've decided to use standardized terminology across states to allow us to consistently capture policies. The terminology may differ from the specific terminology used in each state or territory. So you'll need to make sure that the terminology that we're using in the database matches the terminology you're using in your research. Another consideration is how the variables can be used. In many cases, the variables can be used as coded, but in other cases, they may need to be combined with other variables, such as the copayment amount variables that need to be used in combination with a few others that indicate whether the amounts are in dollars or percentages, and whether the variables that define the income thresholds for each amount So when you're calculating co-payments using the data files, you'll need to make sure that you are using the co-payment income thresholds, the co-payment amounts, and the co-payment adjustment category. There are also cases in the database where coding is other or varies, as I mentioned earlier, and those notes fields are really important for you to be able to pick up the additional detail as to how they vary for different cases. In these cases, you may need to review the notes specifically to determine if you can code a policy a certain way for your analysis, or if the variable or state needed to be dropped from your analysis. Finally, there are cases throughout the data files where the policy information was not available at the time that the policy information was coded into the database. So, and that therefore the variable is coded as missing data. And so in these cases, you may decide that you want to drop these cases altogether or default them to a certain coding option. And so these are all just really important things for you to keep in mind as you're working through the data files and determining whether they're the right fit for your own research. I wanted to leave you with a little bit of additional information and about the database. As I mentioned, it is funded by the Office of Planning, Research, and Evaluation. And I'd like to thank our project team who are all on the call today, Sarah, Danielle, and Linda, as well as our OPRE project officers, Kathleen Dwyer and Sarah Blankenship. And now I'm going to turn it back over to Bianca to finish up with how to access the data files through the Child and Family Data Archive.
Thank you, Kelly. You can go to the next slide. Thank you. Okay. So to access the CCDF Policies Database, you can visit the Child and Family Data Archive website at childandfamilydataarchive.org. And then to find the study, you would enter the study title or acronym into the search box highlighted here and hit return. On the search results page, click on the CCDF Policies Database study title to be directed to the study homepage. So on the next slide, please. Here is a screenshot of the CCDF Policies Database homepage. The homepage is where you will access the data and find important information about the study. The At a Glance tab highlighted here is where you will find a summary about the data and information on the study's design, sampling, data collection period, and more. In the summary fields, you can also find links to the CCDF project website and search tool noted in the data files and documentation section of this presentation. Next slide, please. The Variables tab highlighted here allows users to search and compare variables in the data using our variable level search tool. You can simply enter in words or strings that relate to your measures of interest in the search box highlighted, and then the search results will return related variables, including information on the variable name, label type, and associated data set. The variable level search tool is another great way to identify variables of interest in addition to exploring the study user guide and code books for this study. On the Data and Documentation tab, you can download the data and documentation by file level. On this tab, you're also able to preview the study user guide and dataset code books before downloading any documentation to your computer. To download the files for all data sets listed, you can use a download drop-down menu highlighted above the Data and Documentation tab. If you experience issues accessing the data, or if you have general questions about the study, archive staff are always available to assist you. Just email us at cfdata-help@umich.edu with your questions. Next slide. And now we're happy to take a few questions. So again, if you need to clarify your question, please use the features to raise your hand in Zoom, and then we can unmute your mic. Okay, so we have a question for the urban team, and that is, what type of information are you collecting on policies related to COVID-19, and when will they be available online?
Sure, that's a great question. So through our annual research cycle, which I described earlier, of collecting materials from state caseworker manuals or updates in whatever form they're issued. We've been able to collect information about state and territory responses to COVID-19 in their CCDF programs. We've also been able to be in contact with states through our annual verification process, where we've been able to find out more information about how they've been responding to COVID-19. We also decided, in addition to our regularly included policies in our the tables that we send states and territories to verify, we decided to include some appendix tables asking specific questions or highlighting specific policies that we thought were most relevant to state and territory responses to the COVID-19 pandemic, including changing eligibility requirements for essential workers, waiving co-payments, and waiving requirements for providers such as health and safety requirements. And we've been able to get a lot of good information from states and territories in that form. And we are planning to release this data later this year through our annual report, through companion briefs on our project website and in the data files. And so, yeah, you can expect that data out later this year or early next year. And I see that Sheila asked in the chat if this recording will be shared with attendees, so I'll let Bianca answer that for us.
Yes, the recording will be shared with attendees. And so Stephanie, feel free to jump in, but I believe we will send an email out to everybody who's present here today. And then we're also going to go ahead and apply the closed captioning and post the video up on the Child and Family Data Archive's YouTube channel. The Child and Family Data Archive is also working to announce recordings and share our recordings through our newsletter that we've created. And so again, if you're interested in receiving those links as well as additional information on upcoming events, I encourage you to visit the Child and Family Data Archive's website, go to the Contact Us page and sign up for our newsletter, because we will also be including the recordings in that newsletter at a later date. Okay, so we have another question. Not sure if I missed this part, but is the data available programmatically, or do you have to download the data manually? So again, I think you can just visit the Child and Family Data Archive website. You're going to want to navigate to the study homepage with the method that we described, of course, just entering CCDF into this search engine, navigating to the CCDF study homepage, and then going to that data and documentation tab. And if you go to the data and documentation tab, you can just download all of the data and all of the related materials and documents. And the data are made available, through a suite of statistical packages so that it's easier, more accessible to our users. And we also have an Excel spreadsheet that's available. So we have the data available in SPSS, SAS, Stata, and R for users to use in their preferred statistical package. But yes, it's available just right on the study homepage. Thank you for that question.
It looks like we have another question, so I'll read that out loud. Are all state payment rate tables applicable for all or nearly all areas in each state, with considerations such as childcare setting, QRIS, and child age collected and publicly available in the database? And similarly, are all or nearly all co-payment tables that are applicable for all areas in each state collected and publicly available? Thanks for that question. It's a really good question. So I can try to walk through each piece and break down what's available in the data files for you. So we try as best as possible to pick up sub-state variation in reimbursement rates. In the example that I showed in Massachusetts, they have 6 regions. And so we try to pick up the reimbursement rates for all 6 regions in the database. We also pick up reimbursement rates by provider type. So across 4 broad provider categories, which are center-based care, family child care, group family child care, and in-home care. And within each of those categories, we do pick up variations by licensure and also pick up differences in reimbursement rates or payment rates if they have tiered rates. So some of you may be familiar with our book of tables where we show 2 different rates, which we call base and highest for each state, age, and provider type. So in order to do that, we need to pick up payment rates by QRIS status. And yes, we do pick up differences in reimbursement rates by child age. And we make sure that however the state defines their age categories, we're picking up the rates in correspondence with that. So when you download the data files and the corresponding code books, you'll note that the reimbursement rate categories will say that you should be using those files in conjunction with the reimbursement rate policies files so that you can see how the state that you're interested in defines their age categories because each state may define infant or toddler at a different age. And then that information, those age ranges then affect how we code the reimbursement rates into the database. So to answer that question, yes, we have publicly available information on payment rates by area of the state, child age, child care setting, QRS, all publicly available. I will note that if a state has different payment rates for every single county, and there are 60 counties in a state, we're not able to capture that level of detail. And so in that case, we select a subset of the counties to code that information into the database. Similarly, for co-payment tables, we are able to pick up information for certain states or sub-state areas in certain states. I'm thinking off the top of my head in Texas, in New York, in Florida, and I think in Colorado, we're able to pick up sub-state variations in co-payment amounts. And to the extent that they vary by perhaps number of children in care or length of time in care, we try to pick that up as well. And this is where those family group header record variables come into play, as well as the category notes, which might provide additional information that's not available just in the co-payment tables when you're looking at calculating co-payment amounts for different families. I hope that answered your question. And yeah, that was a great question. Thank you. There's another question in the chat. When coding from the state documents, do you use any electronic coding software, or is it done manually by staff? This is another good question. So if you're asking if we use like a qualitative coding software when reviewing the state manuals, the answer is no. This is all done manually by staff. All the staff on the database undergo a pretty, I would say, rigorous training process where we walk through every single policy variable and category in the database in order to understand how they all interact with each other before staff members start coding that information into the database. And the user guide that I referenced throughout the presentation is also the user guide that staff members use when coding policies from caseworker manuals into the database. So you'll have a good understanding of how the thought process that went into coding that information into the database when you're using the user guide. I hope that answered your question.
Okay. Our next question is, what if the county or other sub-state area I'm interested in isn't included as a sub-state area in the database?
Yeah, that's a good question. As I mentioned, sometimes, especially for reimbursement rate policies, we're not able to capture all of the specific sub-state variation, either due to volume of information, or sometimes sub-state information just isn't available to us readily when we're coding that information into the database. So I would say in that case, it would be a good idea for you to use the majority record variables that I mentioned earlier, because these show the general policies in the state at a specific point in time. And so if you're specifically interested in a substate area that isn't included, I think that using the majority records are your best bet is at getting a good idea of what was happening in the CCDF program in that state at that point in time.
Okay, and this question is for me, is I visited the study homepage, but I'm not finding the study user guide. Where am I able to access this document? So if you go to access any of if you go to download any of the files, whether you are downloading at file level or whether you are downloading the full study package, this user guide is going to be included in the files that are downloaded to your computer. But you can also go to the study and documentation tab, and the user guide is found. You're able to preview it just from the study homepage without downloading it in the view all study, the all study file level that's on the study homepage. So that's where the user guide is located there. Okay, and the next question is about missing values. So what do I do about missing values when using the data?
That's another good question. As I mentioned a little bit during my presentation, there are some cases in the data files where the value of the policy variable might be shown as missing or not in manual. This could occur because we weren't able to find that information at the time we were coding. And so when this happens, I would recommend that you assess whether you still need to use that policy variable. If you're only looking at one specific state and that information is missing, it might be a good idea to drop that variable from your analysis. Alternatively, you might be able to review other policies that are similar or policies similar in another state and determine if you can make a if you can determine if there's just a blanket coding option that you could assign to states that have a missing value for a specific policy variable. And those are my two main recommendations for handling missing values in the database.
Okay, the next question is for us, and it pertains to using the data to submit a paper to a journal, or wanting to have that paper wanting to have the publication display on the related publications tab that appears when you navigate to the study homepage. So if you are using these data to work towards publishing a paper, we recommend that you provide the citation to cfdata-help@umich.edu, just so that we can review the publication, share that information with Urban, of course, and then also post it to the related publication section on the study homepage so that users are able to see how these data are being used and have those publications as a resource available. That's a great question. Thank you. Okay, another question for Urban. What if I use an older year's data files in my research and the information I used has since been updated?
Yeah, that's a good question. So as I mentioned earlier, when you're doing research now, you should always be trying to use the most recent year of data files. This is because over time, through our annual verification process and through our annual policy collection and coding process, we're sometimes able to fill in missing information that we weren't able to acquire previously, or we might find out information that leads us to believe that perhaps how we coded a variable in the past wasn't correct. And so I would say that just like going forward, you should be sure to use the most recent year of the data files in your research in order to have all the most up-to-date questions. And in the past, like speaking about previous work that included data that is now maybe considered out of date, it's just important to know that we are continually trying to update and improve the database and the data files in order to make sure that we're providing the most accurate source of data and information for all researchers available.
Okay. Just going to give it another minute to see if we have any last minute questions before we move on to our last slide. Okay, did you want to move to the next slide, please? So just remember to visit the Child and Family Data Archive website to get access to these data. And as I mentioned during the Q&A portion, you can also sign up for our listserv to receive notifications on data release announcements, data webinars, and workshops through the site. Lastly, please contact us at cfdata-help@umich.edu for questions or assistance. And thank you everybody for taking time to join us. And thank you to the folks at Urban for sharing all of this great information.